coming to the Survivorship Wellness Series, lecture series. This is, we have two more lectures to come in the coming months. One is Katie Devine and one is Alyssa Bark. I'll be talking about that in a minute. Move to the next slide, Angela. So the center here at the Cancer Institute, the mission is to provide better care and resources to improve quality of life and enhance outcomes for cancer survivors in our state of New Jersey. As part of that, our goals are to identify unmet needs and disparities and study some of the long-term outcomes among survivors in our state, and to try and develop over time best practice survivorship care for survivors, both at CINJ, which is the main cancer center, but also our other sites across New Jersey. It's part of the Rodwood Johnson Barnabas Health System. Next slide, please. Thanks, Angela. So as I mentioned before, Angela will be speaking today on a very interesting topic and an important topic, which is physical activity and cancer survivorship. And then we have two other lectures. One is Dr. Devine, who will be talking about adolescent and young adult survivors, psychosocial issues and post-treatment care. And Alyssa Bark will be talking about our OTR. We'll be talking about managing lymphedema. These will happen in April and May, and we hope if you're interested in the topics that you'll join us. The next slide, please. So this fall we have, hopefully this fall, we have two talks also in our continuing survey series. One is on financial issues and financial navigation for cancer patients and survivors, which is a very important topic for many people whose bills come after they complete treatment. And then a very interesting lecture on oncofertility by our oncofertility specialist, which I think is an important topic for people who go into treatments where afterwards they will not be able to have children by normal means. So there's a survey that we'll give at the end of the lecture today. And we hope that you can fill it out for us because it's important for us to hear from you in terms of what your needs and concerns are and different topics that you'd like to hear about. And I think this is my last slide before Angela speaks, but sometimes I'm surprised that there's another slide.
You have a few more slides.
Keep going. So this is the pamphlet that we will be mailing to you after you've completed listening today. This is a wellness pamphlet. It talks about dietary issues, tobacco cessation, and emotional well-being, and talks a little bit about the resources that are available to you both at our cancer center and in general from the National Cancer Institute and the cancer support and wellness community. Next slide. We do have a website where we store all of these talks. So all the prior talks are stored there. And we do have a fair number of other resources that we have put into the survivorship website for you to look at in terms of pamphlets and resources for cancer survivors. So it's a nice resource in case you're wanting to find online intervention resources as well as our talks, which we are saving for everyone to look at and view. Next slide, I think. So I'm really happy to introduce Angela Fong. She's a member of our Cancer Prevention and Control Program at Rutgers Cancer Institute of New Jersey and a kinesiologist whose expertise is in exercise oncology. And I'm really happy she's here today to talk about physical activity for cancer survivors. Take it away, Angela. Thanks for showing the slides.
And I guess this will be repeated, but here's a slide for just this information. Okay, so yeah, thank you to the Cancer Survivorship and Outcomes Center for this invitation, specifically to Drs. Manning and Evans. I'm really excited to do this event because patient-centered events really kind of inspire me to continue doing the work that I do, especially because it is really important, but also because I really enjoy this work. So the title of my talk is Let's Get Moving, and we're going to talk today about the benefits of exercise for persons diagnosed with cancer. And then because I'm a behavioral scientist by training, we're actually going to talk about different ways that you can become or engage in activity and kind of build the habit of activity. So less of I think what you would see in like social media or in the media broadly, but more like scientifically backed strategies for becoming more active. So a little bit of background on myself. As Dr. Manny said, I am a kinesiologist by training. So I did my Bachelor of Arts in kinesiology. I had my certification in kinesiology to practice, and this was back in when I was still living in Canada. So I unfortunately can't do that here anymore, but that's okay. And I really got interested in the field of exercise oncology because I happened to volunteer in a lab when I was in my undergraduate, and they were running a treadmill walking program for women diagnosed with breast cancer. And what I found really interesting about it was that it was, a really simple movement. We were just walking. I was walking with them, and I was seeing what I thought were very like profound impacts, but not necessarily on the things that as a kinesiologist I would expect. We didn't see like massive changes in their cardiovascular fitness. They didn't gain a ton of muscle or anything like that, but they always kept telling me how they were feeling better. They felt happier, and they kept saying, like, oh, I want to walk forever. I want to come back. I want this program to last forever. And so that kind of instilled in me that we need to do more research to kind of get more women involved in exercise, more women diagnosed with cancer involved in exercise. So that kind of led me down this path. And now I'm here at the Rutgers Cancer Institute, and this is my my lab. And in this space, I am very fortunate to be able to conduct the research that I conduct. Working with my staff, we run exercise interventions out of this lab. Most of our assessments occur in this space, and then the intervention itself is actually more home-based, and we run it over platforms like Zoom. So today I'm going to, again, dive into a little bit of the science, but also some behavioral strategies. But what I first want to do is start out with a patient story. So this is a former client of mine. I'm using a pseudonym. Her name isn't actually Chloe, but I'll describe kind of our interaction. And unfortunately, I didn't get her full permission to share her photographs. So when we see the photographs of her, I've put a lovely smiley face on top of her face, but she is happy behind that smiley face emoji. And then afterwards, I'll go into the science and talk about the benefits of exercise for persons diagnosed with cancer. We'll talk about the exercise guidelines that have been specifically developed for this population. And what I'll do is kind of distill what those guidelines actually mean, because they can be a little bit confusing. And then after, I'll go into behavioral techniques. And these techniques will discuss what you can do to help yourself become a little bit more active. And then we'll open it up for some questions. And I believe we also have some housekeeping notes at the end as well. Okay, so I want to introduce everyone to Chloe. So this photo, again, trust me, she is happy behind the happy face emoji there. So she is what I think some clinicians would call like a unique or special case. She was quite an active individual prior to her diagnosis. And then in 2015, at the age of 30, she was diagnosed with stage 3 breast cancer. The kind of caveat about her diagnosis is that she actually had no family history of cancer. So it was very strange that she had been diagnosed. She was treated with chemotherapy. She had a double mastectomy, reconstructive surgery, radiation. She's on Herceptin, and she's had additional surgery since then. And of course, after that whole gamut of her treatment, she had a lot of post-treatment side effects and lingering effects. So the first and foremost was fatigue, followed by chemo brain or like brain fog, and then of course weight gain. And so in this photo here, this is her in the infusion. And at this point, she was, as she would tell me, she was not ready to hear about exercise because she was very focused on feeling better and, surviving her cancer. At some point, she did start to walk during her treatment when she felt well enough. But I remember her telling me that she didn't do a lot of walking. So the walking was mainly around, living room space, maybe outside, she would walk 3 or 4 houses down the block, turn around and come back, that type of thing. But she did a little bit of walking, and she said it kind of helped her feel better. In 2017, she was given what we call like an all clear by her doctor so that she could re-engage in exercise. And in between the time of 2015 and up to about 2017, she really credits exercise with helping her feel better. So the quote that I have from her is, all I could physically do most days was force myself to walk. And then she even says here, even just around the block on my worst days, and it really helped. So in 2017, when she got that all clear, she really wanted to engage in more activity. She began high intensity interval training, and actually began marathon training in 2018, which I think is really cool. I think in 2018, she ran her first half marathon, which was absolutely wonderful. And I know she absolutely crushed it. And she really credits exercise for really helping her both mentally and physically. She said that it really helped with the lasting symptoms of the cancer treatment and the hormonal therapy. And she said that it really helped with her brain fog as well, that it provided moments of clarity for her, helped her improve her stamina. She says that for her to maintain her exercise, the real key for her was social support. So that's why she did the running, was because she found a local running group where she said, I was leading the caboose, so she was the back of the pack, but she really liked being around other people and exercising. And then she said she even drew support from the other runners who were, as she says, of all ages, all shapes, all sizes, and all abilities. And that really helped her continue her journey. And when Chloe and I were interacting back in the day when she was my client, I had a lot of questions about what it was specifically about exercise that made her feel better. And I wanted her to kind of reflect on her experience with exercise as a cancer survivor. So her first quote here is that what she really wanted from her oncology care teams, or the clinicians that she was working with, was that she wanted them to talk to her about exercise, but because, their role is very much on curing cancer and making her feel better, they were very focused on the cancer itself, and specifically, her age being so young at the time of diagnosis, her lack of, or her family history, which originally they thought was the cause, and then finding out it's a lack of family history. And really at that point, she wanted to kind of start to talk about exercise and her life, after treatment. This quote here highlights that for her, exercise was kind of important throughout her journey. She says, at the beginning, she wasn't ready to engage in exercise because she was, handling the diagnosis, the treatments, but towards the end of treatment, she wanted to walk more. And she really credits, again, the walking with helping her cope. And then finally, this is definitely like my favorite quote from her, where she says that she needed the exercise and that she wouldn't be where she is now. And I think that's both a mental and physical thing. And I really like the part where she says that some days it was the running that got her out of bed, and that it's part of her life now. And I recognize that Chloe's story is definitely not, the be all and end all. I'm not saying that all cancer survivors have to go out and run a half marathon in order to feel better, but I think the important parts are the fact that she did what she felt she could, and that was enough for her and helped her, and she was building on that skill. So she started again walking around the block. Like I use that example of 4 houses because it's a nice, visual representation. There's no, you don't have to measure anything on a watch or anything like that. You can just kind of go. And, she slowly built up from there and eventually got to her distance running. And so that's kind of the big takeaway that I'm hoping everyone gets from Chloe's amazing story. Okay, so we understand a little bit based on Chloe's story that there are obvious benefits of exercise for persons diagnosed with cancer. And what I'd like to do is give you a really, we'll call it a summary of the evidence. So we're very fortunate now that we have a very large and robust scientific base for physical activity and cancer. So if we look at the pre-diagnosis stage, obviously we understand that physical activity can help prevent cancer, and this is through the modulation of energy balance and through immune response. So essentially, helping us with maintaining helping us maintain our immune function and weight maintenance, so that hopefully we don't get diagnosed with cancer. But also there's this less so of an emerging concept, but more of a newer concept called prehabilitation. And this is where there's evidence that supports engaging in exercise prior to having treatment so that physical functioning is at a kind of an elevated baseline. And after treatment, then we have less of a fallback in terms of the physical functioning here. Okay, and so there's a lot of evidence for, emerging evidence for the benefits of physical activity during treatment. So again, we go back to this idea of physical functioning, where an individual, if they're engaging in exercise, they can kind of maintain a slightly higher baseline for how they feel. And that is in all ranges of their movement and their ability to tolerate some of the treatment. There is evidence that we have now that there could be some benefits on how someone can tolerate the treatment if they're exercising at that time. We actually have the most robust evidence for this early phase. So the early post-treatment phase, so we're looking about 6 months upwards to approximately 5 years after the active phase of treatment is done. And here is where we see benefits of physical activity for obviously physical health. So, decreasing any sort of physical symptom related stemming from the treatment, as well as improvements on mental health, such as mood and decreases in self-reported anxiety, as well as self-reported depression symptoms. We see improvements in social well-being. So sometimes when we're engaging in physical activity, we're actually could be engaging in groups, so we're engaging with other people and improving our social support that way. And all of this has an important benefit for quality of life. And there's also evidence to suggest that there could be benefits for spirituality. So in the later years following treatment, so we're looking at 6 years down the line, 10 years, whatnot, physical activity can have prolonged effects and can reduce the instances of comorbidities such as cardiovascular disease and type 2 diabetes, reduce the risks related to recurrence, as well as diagnosis of secondary cancers. And then finally, physical activity has been shown to increase coping at more the end of life and palliative stages of the cancer trajectory. And I think that's a really interesting piece, because I think a lot of people don't necessarily think about physical activity at that time point. And so from the whole gamut, what we see here is that there's a lot of evidence. A lot of this evidence is quite rigorous. So we're this is from very well-designed randomized control trials and experiments, and there's been very few adverse events. So that's what that's saying, is that physical activity is actually safe at all of these different stages. All right, so again, the overview that I have here is just to kind of the highlights of the evidence. So we have the strongest evidence for physical health benefits. So that's showing that physical activity can improve cancer-related fatigue. It does not exacerbate lymphedema. And there's improved function. We have moderate evidence for improved bone health through improved bone mineral density and slowed loss of bone mineral density, as well as improved sleep quality. We have strong evidence for physical activity, improving anxiety, depressive symptoms, and then again, health-related quality of life. And then strong evidence that exercise reduces the risks for comorbidities and similar diseases, as well as secondary cancers. All right. So this robust evidence led to the development of exercise guidelines that are specific for persons diagnosed with cancer. And I say persons diagnosed with cancer because it is, again, throughout the trajectory from the time of diagnosis onward. And they've been developed by two of our kind of leading agencies. So the American Cancer Society, which I'm sure many of you are familiar with, and then the American College of Sports Medicine. So essentially, if we think back to Chloe, we can see that she was a little bit active before her cancer diagnosis. And then she says that, that she wasn't sure where she would be without doing some walking during her treatment. And again, I understand that at this point, at the point of treatment, many cancer survivors may not be ready to hear that information. So these guidelines are really helpful because it really highlights that individuals can safely engage in moderate amounts of exercise, whether they're on active treatment or they completed their active treatment phase. Again, reiterating the benefits of improving quality of life, and then obviously improving fitness, which is very important. So the important thing is to understand how much exercise. And I think this is the part where people get a little either confused or overwhelmed. So the exercise prescription is 115 minutes of moderate to vigorous intensity aerobic exercise that's spread out over 3 to 5 days. And then adding resistance training, so that's another word for strength training or weightlifting, at least 2 days per week. And that each session should include a warm-up and a cool down. So as a kinesiologist, and I think anyone who is kind of trained in that world, when you see that, it makes sense. But understanding, I always joke, like if I showed this to my parents, they would have no idea what 115 minutes of moderate intensity aerobic activity means. And so I always tell people that's wonderful, but what does it actually mean? What do the guidelines look like when they're in practice? So aerobic exercise, the very kinesiology definition is that it's rhythmic, repeated movements of the same major muscle groups. You can think of it as walking, running, biking, dancing, anything that involves, again, this repetitive movement. And I always like to stress here that it does not have to be running. You do not have to run a long distance for exercise to count. Again, walking as much as you can, and building from there still counts as aerobic exercise. So again, according to the guidelines, you want to aim for 115 minutes of this moderate intensity. And so moderate intensity is the key here. And I will talk about that a little bit. And again, you want to spread this out over 3 to 5 days. So you don't want to try to accumulate 150 minutes in one day to meet your guideline. You want to spread it out so that you're able to gain the full benefits. And the best part is that you can do this exercise in bouts of 10 minutes or longer. So for instance, if we're going to spread out aerobic activity over 5 days, that's approximately 30 minutes of activity over the 5 days. So you can actually break that up into 10-minute little bouts of exercise, or snacks of exercise, as some people like to call them, where in the morning, let's say you do a quick 10-minute walk, go about your day. Then at lunchtime, you take a walk around the block, another 10 minutes, go about your day. And then after dinner, you take another 10-minute walk around your neighborhood. And in that time, you've accumulated your 30 minutes, but you've broken it up into very manageable pieces. So this idea of moderate intensity is can be confusing for some people. A lot of kinesiologists and exercise professionals like to use a scale of 1 to 10 to kind of rate moderate intensity. What you're aiming for is about a 4 to a 6. So as it says in the diagram, you're breathing heavy, you can hold a short conversation, but it's becoming noticeably more challenging. So what I like to tell people is, if, again, using this example of walking, if you're going for a walk and you're doing it at a moderate intensity, when you're walking with, let's say, a friend, or sometimes what I like to do is take my phone calls on a walk. And while I'm walking, I should be able to kind of maintain a conversation with my friend, would not be able to speak as clearly as I am now, but I'm able to kind of have a conversation, but it's getting tougher. Another way, again, sticking with walking as our example, if you're walking, you want to walk as if you're late for an appointment. That is what is moderate, so like a brisk pace. And I think these are kind of, I guess, simpler ways to kind of manage our intensity without needing any sort of fancy equipment, not needing to test, our pulse or anything like that, so that you're at that intensity level. Okay, so resistance exercise or weightlifting or strength training. Again, so this is brief repetitive exercise that's meant to increase muscle strength. So essentially, your muscles are resisting a force. And I do like to say that they're resisting a force because weightlifting does not necessarily mean, really heavy weights, dumbbells, or anything like that. It can be resistance bands, as we see in the photo here, or it can even be body weight exercises. So let's say doing a modified push-up on the floor, that is still resistance exercise or strength training or weightlifting. So you want to do this 2 days a week, and you want to exercise the major muscle groups of the upper, mid, and lower body. You want to do 8 to 10 repetitions of the movement and 1 to 2 sets. And by doing this, you are meeting the guidelines. And so a repetition is a full movement. So for instance, a bicep curl, so you're starting fully open, coming all the way back up. You would do that 8 to 10 times, take a break, and that counts as 1 set. And then again, you do it again. So that's the breakdown of the strength training. I think this piece is a little bit simpler for most people to understand, just because we see it so much in the media, but I do still like to break it down. Okay, so there was a piece also about the warm up and cool down. So the reason why this was added to the guidelines was for safety reasons in particular, because you don't want to just dive into activity, because if your muscles are what we call cold, so they haven't been active yet, they haven't become used to the movement, you could injure yourself. And then again, just like a sudden change in heart rate could be potentially dangerous, depending on the types of hormonal therapies and whatnot that you're currently on. So with a warm up, you want to engage in 5 to 10 minutes of light intensity movement and slowly warm up those muscles and joints and slowly increase the heart rate. The warm up, the movements can mimic what you're going to be doing. So for instance, if you're working on a bicep curl, you would do maybe just air bicep curls without any weights, just to get your body used to that movement. And then the cool down is the opposite. So you want to slowly decrease that heart rate. You don't want to suddenly stop and then have your heart rate drop again for safety purposes. So this is 5 to 10 minutes of stretching, and again, slower movements, so we can decrease the heart rate and keep everyone safe. So if you're part of this, you will be getting a PDF package that has this diagram, but this is essentially a prescription, an exercise prescription for different cancer-related outcomes. So we have cancer-related fatigue, health-related quality of life, physical function, anxiety, depression, lymphedema, bone health, and sleep. And in each column, we have the different types of exercise. So again, aerobic only, so that's only our walking, running, biking, dancing, whatnot, and how much to do each week in order to gain this outcome. And this is again based on the science that we have to date. And then the same thing, you'll see the same for resistance, and then one at the end for the combined aerobic and resistance. And I think this is a really helpful guide if you're not sure where to start. So if you want, you can use your phone or the camera on your phone to scan the QR code and download it. But I know that Jacinta has a PDF that I put together for her that has this diagram in it. Okay, so now that we understand the benefits of exercise, we understand what the guidelines actually are and what they mean. This is the really tough part, is the how to actually engage in exercise. So drawing on, again, my training and interest, I'm going to go over some behavioral techniques that will help you become a little bit more active. So the first is how to start. You want to start small and build up. And that's based on where you are with your own physical activity levels. So if you were active prior, your small may look different from someone who wasn't active prior to their diagnosis. And then remember, you can just do exercise in 10-minute bouts. There is a movement in the exercise world broadly, exercise science world broadly, where we're talking about exercise snacks. So engaging in really small bouts of exercise and using that to increase and eventually meet guidelines. And then I always recommend picking an activity that you enjoy. I've been asked in the past, what is the quote unquote perfect exercise? And I always say the perfect exercise is the one that you're going to do and the one that you like. So just because you have a friend who enjoys long distance running does not mean you have to become a long distance runner. You can do anything else that moves your body and makes you feel good. So I have friends who are lifelong Zumba enthusiasts, and that's what they love to do. They love to dance, and that's what's helped them meet their physical activity guidelines after they were treated for cancer. I have other previous clients of mine who were very into dragon boat because of the community around breast cancer and dragon boating, and that is that is their thing and they love doing dragon boat. I have others who've rediscovered ballet as adults and will do that. And so I suggest picking an activity that you just like, because you're more likely to continue doing it. The next thing you want to do is, again, set these graded tasks. So you don't want to go in whole hog, as some people say, but you don't want to go into your exercise wanting to do everything at the exact same time. You want to set smaller tasks, get those done, and then kind of increase your confidence from there and then build. So if it means the first few months of exercise, you're only doing 10 minutes a day, that's fantastic, because that 10 minutes a day will build up over time and it's still more than what you were doing the week before. And then let's say after a month of doing 10 minutes of walking every day, or not every day, but let's say 5 days a week, you're doing 10 minutes a day. You're not meeting guidelines yet, but if you're consistent with that, that's fantastic. Maybe in a month's time, you increase it to 20 minutes and you try to do that 5 times a week and eventually get up to the 30 minutes so that you can meet these guidelines. You want to set these tasks to be achievable, because that, again, will increase your confidence and your ability to continue exercising. The next thing you want to do is place prompts or cues around your environment. So this can mean anything. Like, for instance, for me, I like to have my running shoes kind of in a very inconvenient spot near the door. So if I have my doorway, I kind of place them right in the middle so that they're very much in my way and I have to either move them in order to get outside. But it's a nice reminder to me that I should probably go for a walk or a short run or something because my shoes are there. I had a previous client who had a very bright water bottle that she absolutely loved. And so she would place that by the door as a visual cue to remember, like, okay, I need to get outside and exercise, or I need to go to whatever studio and exercise. You can also put alarms or calendar events in your phone or in your day planners and actually schedule exercise and have that as a reminder. Individuals like to place Post-it notes around their homes to remind them to exercise. So anything that will sort of remind you that it's something that you need to do. One of my favorite tips is to find social support for exercise. So this can mean lots of things. It could mean literally someone who comes out with you to exercise. So a walking buddy, someone you meet with at like a gym or a class in order to become to be active. It could also be someone who just helps you in your activities. So in using myself as an example, I enjoy long distance running, and my husband's actually my biggest support. So when I'm on my longer runs, he actually will, one of the routes I do, I run by my home twice. And on the first time I run by, he's out there with the water and my fuel, so I can grab that and continue exercising. You can also have physical activity role models. So perhaps there's someone either famous or in your social circle that you really, appreciate or admire how far they've come in their physical activity journey. And you can use them as, again, social support. Ask them for advice or ask them to come, support you on a walk. Other individuals can be the individuals that literally remind you to exercise or that you have to report to. So for instance, my sister and I are accountability buddies. So whenever I exercise, I text her and tell her that I've exercised, and then she does the same. She'll text me. And we try to keep each other accountable in that way. Another way is also using someone for emotional support. So just having them be there for you, whatever that looks like, so that you can engage in physical activity. And I think social support is probably one of the stronger behavioral techniques to help you become more active. Okay. Another one is action planning. So very much exactly as it sounds, you want to plan the frequency, the intensity, the duration, the type of activity that you're going to do. So for instance, if we're using walking as an example, you say you want to walk 5 times a week a week for upwards of 30 minutes a time. So we have our frequency, which is the 5 days. The intensity, it's going to be moderate, we're hoping. So we're walking as if we're late for an appointment. The duration is 30 minutes, but let's say we're just starting out. So we're going to break it into 10-minute chunks. And then the type is walking. And then this including contextual factors. So we're not always able to walk, the weather was not so great in where I live in New Jersey today, so the walking was likely not going to happen. So what is our backup plan? It could be walking on a treadmill. If you don't have access to that, it could be walking around your home. I live in an apartment building, so for me, it meant walking in the hallways of my apartment and kind of just doing a tour of my own space. Also consider any other like equipment you might need, making sure you have enough water, that type of thing. You kind of plan all those things into your exercise. You don't have to write them down. I suggest doing it because it makes you a bit more cognizant of what you're doing. But at the same time, it's really important to kind of keep these other factors in play so that when you do engage in activity and there is, let's say, a barrier like weather, you have a plan for overcoming it. This one's really important. It's rewards. So you want to, like we learned in Parks and Rec, you want to treat yourself. It could be something as simple as buying a new thing. If you don't find value in that, or you don't have the means to, my favorite, honestly, is self-praise, is literally telling myself how proud I am of myself for getting out there, even though I didn't want to, even though it was raining, it was whatever. This is really important because, again, exercise is hard and rewards like this will keep you going. Positive reinforcement from others, again, using my husband as an example, I actually have him tell me that he thinks I'm great when I come back from a long run. So I highly suggest doing that, is using people around you to help you maintain your physical activity through rewards like this. Again, they don't always have to be a thing. Sometimes it can be just something really simple, or what I tell myself is, if I go on this longer run, I get to watch, my favorite reality TV show when I get home. So that's something that really motivates me to keep going. Okay, and again, this will be in the PDF that I gave to Jacinta, but here are some resources for exercise and cancer. So the first two are physical therapy, one through our group, and then Revital Cancer Rehabilitation, which is more cancer specific, and then the American College of Sports Medicine Cancer and Exercise Directory. So this directory is really interesting because you can use it to find cancer and exercise specific programming depending on where you live. So it has just a bunch of classes as well as trainers who have specific certification all listed on there. So you can use that as a resource to find places to be active. And then if you're traveling, you could also use it to find, or I guess traveling within the United States, you can find programming where you're going to be. And I'm just coming to the end here because I wanted to leave time for questions, but I just wanted to acknowledge my team. So my current team, Amanda, Caitlin, Gabby, and Zoe, two of whom are not photographed because they didn't want their photos up, but that's okay. And then I want to, thank my past team because they were so wonderful and really got this research program off the ground. Thank you to the Cancer Survivorship and Outcome Center for always supporting my work, as well as the funding bodies. And then finally, thank you to my participants who are absolutely wonderful and really inspire me to keep doing the work that I'm doing. Okay, so I'll pause there for any questions if anyone has any. Oops, sorry. Does anyone have any specific questions to their situation, or would they like clarification on anything?
I want to chime in. I think, we all know how good and useful exercise is, right? Everybody wants to exercise. A lot of people sign up, but it's so hard. Like when we do interventions, it's just so hard to keep them compliant, to the intervention. And it's how do you overcome that?
Yeah. Thank you, Christine. That's a great question. So the compliance is a hard one. I will give you that. In my studies, we have we use a lot of self-monitoring, which I realized I should have put on the slide. So self-monitoring is essentially tracking your exercise. It could be simple, like paper and pencil, like check mark when you do it. Or like, you know, when you were younger, you got the sticker on like the charts in school, using like a device that really helps. Self-monitoring is actually probably one of the more robust behavior change techniques. And we found, at least in the work that I've done and the work that I've done in my graduate training, is that it's actually, oh, I forget the actual statistic, but it's actually highly correlated to both compliance as well as, or I guess, adherence to the program, and then maintenance upwards of like 3 or 4 months. So that's been our biggest thing. And then, I mean, we do a lot of supervised work, so that really is helpful as well. So having that professional be with them either one-on-one or in a small group. And where, I guess, another way that we've done this too is just accountability through our staff checking in. So individuals, if they're, let's say, in one of my studies, you either get a trainer or you don't. So if you don't get the trainer, we still check in with you to see how you're doing, if you have any questions. And that's usually a very gentle reminder of, oh, right, I'm supposed to be doing these exercises. So it does take a lot of work, but that's how we've been able to maintain our higher level of adherence.
I also find that just having a Fitbit, just having it, and you know, that motivates you to move throughout the day. And therefore there is a lot of articles online, right, about the interventions and the way they track it through the Fitbit data. I guess that's the easiest, right, to track it. But just having a Fitbit, a tracker that you can just download the data and see how much I moved throughout the day, and even the reminders, 10 minutes to an hour, you know, it's like, oh my gosh, I got walk my 250, you know, in 10 minutes. So sometimes I walk around the couch, you know, just
exactly,
it's interesting. I have a question about the remote physical activity interventions. I believe yours are in person, correct?
Our assessments are in person, but the actual intervention is online.
Oh, okay. All right. How does that work? You know, I would assume it's probably, it's number one, easier for everybody to attend, right? Because you can schedule it from wherever you are. But do you find it compatible with in-person exercise interventions?
That's a great question. I actually moved to remote interventions probably in like 2016, 2017. My thing is, I think when you're in person, it's, I would say, simpler to implement, because you can, you know, address someone's form or answer a question right away. Sometimes, you know, when you're using Zoom and, you know, technology can sometimes lag, so you don't quite see exactly what's happening in real time. But I do find that the adherence to the programs have been very similar. And now that we're in this, I don't even know what to call it, this after time, but I think people are becoming used to using Zoom. But on top of that, we're building better ways so that we're able to communicate more effectively through Zoom and still have that social support. That being said, I would like to eventually move to more hybrid models so that we can do a combination in person and Zoom.
Thank you.
Thank you, Christine. I see Caitlin, you have your hand up.
Hi, yeah, so I do have a question. So early on in your talk, you spoke about how Chloe mentioned that she wished her oncology team knew more on the topic of exercise oncology and the benefits. What do you think are like the next steps for this knowledge to occur? I mean, do you think there is enough being done already? I mean, I know, or we know that the care team individuals, they go through a lot of initial schooling and continuing education, right? So should like this education on this topic be included already in established curriculums and continuing education of
Mhm.
the people in the care team going into this field, or do you think maybe it's the responsibility of somebody else?
Yeah, that's a fantastic question. So I think it's kind of both, which is not a great answer. So
Right.
obviously, the oncologists are focused on what they need to be focused on, right? The curative piece. But I think there's a lot to be said about their role in care, in that they are seen as, you know, beacons of health and very like trustworthy health messengers to most cancer survivor populations. And so even just mentioning, you know, I want you to think about exercise, or what are you going to do for exercise when this is all said and done? I think that's helpful to at least get cancer survivors thinking about exercise, because as Chloe said, she wasn't sure she could do any of the walking, but then she felt like she needed to during treatment. And so I think that's a really important piece. But do I think it's solely, you know, the medical team's responsibility? No, because they don't have the time, they can't take it on. They quite frankly don't have the training. I think exercise or aspects of lifestyle, so exercise, healthy diet, are being integrated into or better integrated into medical training. And I think at least on the Canadian side, there are questions now on the licensing exams about lifestyle. I'm not really sure what's happening on the American side of things. So it is starting in that realm. But I think the other piece is just relying on individuals like you and I. So those of us who have that kinesiology training, and looping us into either develop programming or have the like behavioral counseling sessions in order to get cancer survivors more active. So I see a very like integrated approach where it's a lot of different people working. Who's paying for all of it? I don't know. I haven't quite gotten that far, but I know that there have been models like at Memorial Sloan. I know they have like a healthy living program where they get where cancer survivors get screened based on different factors, and if they're not meeting physical activity guidelines, they actually get to an advanced practice nurse who helps them with a program, or sorry, gets them introduced into an exercise and cancer program that's run by an exercise physiologist with training in cancer and exercise, gets them started with that. And then they also get behavioral counseling where they talk about the behavior change techniques. And so they know how to maintain the activity after that program is done.
Right. Okay. Thank you.
Yeah, thank you. Are there any other questions? Jacinta, it's almost 6:20. Do you want me to move on to the closing, or?
Sure. And if anyone has any questions that they don't want to ask out loud in front of everyone, they can always feel free to email me. I believe on the next slide, my contact is written down, and I can forward any inquiries to Angela.
Yeah. So yeah, any additional questions, please email Jacinta. And again, there is a questionnaire about helping us better meet your needs. So please complete that, and we can have programming and have lectures like this that really address the needs that you have.